We got more good news on the vaccine front today. New data out from Pfizer shows their vaccine is 100% effective at preventing illness in kids aged 12 to 15, signaling the shot, which is already cleared for those 16 and up, could soon get emergency approval for these younger teens, too. At the same time, new cases of COVID are still on the rise, up 13% nationally from the week before and up 18% in Massachusetts. But officials say those new cases have been largely concentrated among younger populations, signaling the vaccine rollout, which has prioritized older, higher risk populations, is working as one might expect. But other populations hit hard by the virus are still lagging far behind. The percentage of black people in the state who've received at least one dose is less than their share of the population, though it does rank as second nationally. And that gap is stark for Hispanic people, who make up 12% of the state's population, but just 5% of residents with at least one dose. According to our next guest, in a letter to the governor last week, white residents have received 15 times as many doses as Latinx residents have. In that letter, the Vaccine Equity Now Coalition told Baker, quote, "We are alarmed by the persistent inequities in the Commonwealth's vaccine distribution after so many months of preventable suffering in Black, Latinx, Asian, and immigrant communities during the pandemic. People are dying. Massachusetts residents deserve better." I'm joined now by two members of the coalition, Eva Millona, Executive Director for the Massachusetts Immigrant and Refugee Advocacy Coalition, or MIRA, and Iván Espinoza-Madrigal, the Executive Director of the Lawyers for Civil Rights. Iván, Eva, thanks so much for being here.
Thank you for having us.
Eva, if I can start with you, I know it's not just one thing. What are the primary reasons why these numbers are so low in the Latinx population?
So first, let me say, Jim, you are so right about the vaccine rollout and the deep inequities that we are facing. I do want to recognize the incredible work that has been done by the governor and the administration, but the gaps are really significant because, you know, the immigrant population, the Latinx community, they're most likely to be in the front lines as workers. They take public transportation. They start at a disadvantage. And we need to focus on them as well. And that's why one of the reasons that our coalition came together, that has leaders from the racial justice world, the immigrant justice, the civil rights, and public health, is to really make the case that the communities that have been hit the most also need the attention now. The vaccine, it's not available for all of them. It's great that we have more vaccines coming and the great news today, but the truth is that the vaccine rollout has been deeply inequitable, and especially in the immigrant community when, especially in the mixed status household families, language also, it's a barrier. Immigration status has been an issue of concern. So there are so many things, and the structural racism that has existed for centuries. This is not new, but you know, these collective factors are making it really harder to reach out to those communities. So our coalition came together to really urge the administration that one of the things that needs to be done and needs to, you know, it's a sense of urgency, is the promised 20% additional doses for the communities who have been impacted the most.
Yeah, and Iván, if I can stay on the same subject, the governor was on the radio with us last week. Let me read you exactly what he said to us. "We're almost double the national average on our Latino population, but there we still have work to do." I want to know what your reaction is to that. And you mentioned in the Boston Globe that part of the problem was messaging. A very clever slogan, I thought, "Trust the facts, get the vax," as you said, may work with one population, but not so well with another. What do you mean?
Yes, Jim. And this alludes to what my friend and colleague Eva was just talking about, which are the language barriers. So one of the things that we saw with the translation of that particularly catchy slogan in English is that the word used to translate facts in Spanish, pruebas, has multiple meanings. One of the meanings is to take a quiz or to conduct an exam. it is not related to facts. And so that generated more confusion and uncertainty in families that were already experiencing some vaccine discomfort to begin with.
You know, Eva, when you wrote this letter, you and Iván and a bunch of your colleagues in the coalition, this was, I did the dates, was 6 days after the governor had announced that he was going to spend $27 million in federal funding. That's in addition to focusing on these 20 so-called vulnerable communities to try to deal with this equity problem. I'm assuming you wouldn't have sent a letter if you thought the additional federal money would do the trick. If that won't do it, what would do it? What would directly address and go a long way towards fixing the problem?
So our letter also include gratitude for all that has been done and offering our support to work with the governor and the administration. And yes, there is 27.4 that you mentioned, and that's $4 million will go to the community-based organization, the heroes on the ground. But there is no clarity yet. We don't know the details as how this money will be accessed, how the community groups will be able to have access to these resources to help the hard to reach communities, A, with the messaging, B, will taking them to the sites or work with them. So the letter, also asks for language access and cultural competence across aspects of the vaccine outreach, and also engagement of the communities. My colleague, talked about the language access and the translation. We would like the community groups to have access as soon as possible to the dollars, be part of this implementation, be part of the solution. They are the trusted messengers and those who can really help in getting, the 20% and the most impacted to get the vaccine. So it's key that it happens now. I cannot emphasize enough the sense of urgency.
Iván, at the top of the show, I mentioned the one statistic that I had to read 3 times to see if it could possibly be true. You go to Lawrence, where 82% of the population is Latinx. 2% of that population has been vaccinated, while the white minority, and they are a minority obviously in Lawrence, close to half have been vaccinated. So I juxtapose that with, I'm sure you saw the poll in the Globe today, the Suffolk University poll. Do you approve of Governor Charlie Baker's handling of vaccine distribution? Overall, it's 58%. White people, 53%. Hispanic or Latino people, as they describe them, 82%. The highest approval rating on vaccine distribution comes from the Latinx population. How do you explain that?
Well, ever since presidential polls started getting some of these numbers wrong, I think we need to be a little skeptical about some of this poll data. I don't know who exactly is being polled, but one thing that I do know for sure, and it dovetails with what Eva was just talking about, none of our community partners in Boston or across the state have received resources to do more extensive outreach and engagement with Latinx and immigrant communities. And this means that we are still relying primarily on large vaccination centers that are far from communities of color and inaccessible in many instances through public transit. And so many groups have already taken it upon themselves, including my organization, Lawyers for Civil Rights, to run our own vaccination clinics in partnership with community health centers like the Whittier. And so I don't know where the polling data is coming from, but what I do know is that we are having to fill in the gap for the absence of state coordination and resources.
Eva, have you heard back from the governor's office since you sent the letter, 8 days ago? Have you heard back from them?
We haven't heard back yet, but, we're eager to hear and eager to work with the administration and be part of the solution. As I said, we need a lot of answers. There are unanswered questions in terms of the resources and how those resources will be distributed.
If I can interrupt you, Eva, has your equity coalition been involved in any of the decision making on the state level? Forget the letter for a moment. Prior to that, I see Iván is shaking his head no. You have not had a seat at the table to discuss how to deal with Latinx and immigrant communities, Eva.
Well, I am on the Equity Advisory Board that DPH has created, and I've been part of that from the start as representing MIRA and the immigrant community. But none of our Vaccine Now coalition member represents, the 30+ members of the coalition that are part of this work, who represent among them thousands and thousands of workers on the ground. And we're hearing the stories every day,
Iván, I only have 30 seconds left. If the governor is watching, or some of his people are, what's the single most important thing they have to do tomorrow to move in the direction you both and your colleagues think they must? What's the one most important thing?
Dedicate resources to community-based vaccination efforts and work in partnership with grassroots groups to make that happen.
Fair enough. I wish you both luck with your work. Iván, Eva, thank you so much for being here. I really appreciate it.
Thank you, Jim.
Thank you.